Hello world and hello 2018. It's Dr. Keith, your VR doctor, here returning to talk to you once again about the role of virtual and augmented reality in healthcare. And I'm speaking to you today from this amazing, if slightly echoey facility, the Immersion Lab here at Fusebox Brighton, where I'll be doing some of my clinical VR and AR work in 2018. So you can see right here, a HoloLens, right here, a Vive, and on my head, a Rift. So what are we going to talk about today? Well, it's the new year, it's winter here in the Northern Hemisphere, and at this time of year, there's a lot of pressure on people which can adversely affect their mental health. So how can virtual reality be used to treat mental health problems? Now, I've previously spoken about how you can use virtual reality to treat mental health problems. And in fact, I've categorized how virtual reality might be used to be used in clinical spaces in what I call the 5 ways of clinical virtual reality. If I just grab this camera and move you around, as if by magic, it's right there. So I talk about the 5 ways in which virtual reality can be used clinically. And they are transform, heal, reveal, understand, and expand. So what do I mean by that? Well, transform. Virtual reality can help change for the better, can improve, augment, or make more comfortable existing medical procedures. Virtual reality can heal by acting as a novel therapeutic medium. It can reveal illness as a novel diagnostic medium. It can help people understand healthcare and medicine through education and training, but also help expand people's understanding by allowing them to take different perspectives and maybe even break free of those limitations brought onto them by their illness, what Brennan Spiegel calls the biopsychosocial jail cell of illness. So, what about depression then? I did promise that we'd be talking about this. Now, depression is incredibly common, and it's something that people don't really talk about. It's also increasing in prevalence, it's increasing in the number of people around us too. Now, we have a number of tools that we can use to help treat depression when we identify it, including talking therapies, such as simple counseling, cognitive behavioral therapy, and behavioral activation. There's a long list of different treatments that are used by psychologists and psychiatrists, and of course you have antidepressant medication as well, all bundled in with lifestyle. So you might want to use mindfulness, which can be used within virtual reality, or you might want to use relaxation techniques in virtual reality, or you may just want to opt out of virtual reality completely and go for a walk with your dog and spend time with friends. But what can virtual reality do that you can't do in the physical world? And that's what I find very interesting. And it's the subject of this paper that I'm going to show you in the background. So hopefully you can see this. And this is a paper published back in 2016 by Falconer et al. And it talks about embodying self-compassion within virtual reality and its effects on patients with depression. Now, one of the features of depression is that people lose the ability to have compassion for themselves, self-compassion. And this is thought to be a factor that helps prevent recovery. So how do you help people develop self-compassion? Well, you can use talking therapies and you can use mindfulness, for example. That's a big part of one of these. But what can virtual reality do? Well, in virtual reality, you can, of course, embody an avatar like me. I'm not here, of course, but this is a representation of myself that I can see in the recording just here. So I identify with this avatar. And the researchers use this principle of embodiment to create a scenario where they would have one avatar as the participant, and then they would have another avatar, in this case, a small child that's obviously distressed. And what they would do is they would have a mirror in the room, in this virtual environment, so you could strongly self-identify with the avatar. And it started with a scenario where this child was distressed and crying. And the participants were asked to comfort this child, to be compassionate towards this child. And then after a couple of minutes, the roles were reversed. And interestingly, the participant would then take the role of the child, and they would hear their compassion being played back to them. So, interesting. Very difficult to do in the physical world, I think you'll agree. And did it actually work? Well, in the result of this rather small trial, there was only 15 patients who practiced with this, but 3 repetitions of the scenario led to a significant reduction in the depression severity and self-criticism, which is a significant increase of self-compassion. And this was done over a 4-week period, and it showed clinically significant improvements in 4 patients, which is amazing. So a small study which shows a little introduction to this. So how does this actually look? Now I'm going to play the video in the background, and hopefully it'll play. It's streaming, so let's have a look. Now this is a video provided by the authors themselves, and I'll keep a little bit quiet in the background, see if I can turn the volume up.
It's not nice when things happen to us that we don't like. It's really upset you, hasn't it?
So you can hear in the background the participant, who's a film of them just here, wearing all the VR headsets, comforting this avatar of a child in the background. And you can maybe see in the corner just here the mirror, which helps increase that sense of embodiment inside the avatar. So this would play through for a couple of minutes, and once that was done, it would move on to the second part. And the second part of this would be the role switch. So as you can see here, the participant watches the replay, but from the child's perspective.
It's not nice when things happen to us that we don't like. It's really upset you, hasn't it? You know, sometimes when we're sad, it's really helpful to think of someone who loves us and is kind to us.
I'd say that's pretty good advice. Anyway, you can see how you are physically receiving this compassion that you're giving to yourself. And this small-scale study suggests that that might actually help improve things. So isn't that incredible that you can do this with virtual reality? And I think you'll also agree this would be exceptionally difficult to do in the real world or the physical world. So I'm just going to let these credits run for a moment before we move on to the second thing. So this is something that's going to be developed in the background, and it got me thinking, well, are there any particular tools that I might be able to use? Now here at Fusebox, a colleague pointed me in the direction of an app called MindShow. Now MindShow is an app that runs on HTC Vive, and what it allows you to do is create small theatrical presentations where you, the user, can play every single part. Now it's a little bit difficult to understand, but what that allowed me to do, without any of the specialist software, was mock this up. Now, first thing I'm going to say, this is not meant to be jokey at all, but I was only able to use certain avatars in this particular next demo. So I am a doctor, and to represent the child, I am, sadly, a small cat. But I think you'll get the principle here as well. So let's see if this plays. So you can see it playing in the background. So there's me, and there's me. That's a very strange thing to get your head around. Anyway, what happened in this is I turned the volume up. Now, I'm not a great actor, but this is me taking the perspective of the child that needs comforting. I had a bit of a sore throat at the time. So what would happen is I'd record this, and this is my perspective, and I would then play back, and I would record me comforting the cat that was crying here in the background. And then what would then happen is I could step out afterwards and see it from the other perspective.
Hey, it's okay. It's okay, I'm right here. And I'm listening. Oh, I'm so sorry you feel sad. And I hear you. People can feel sad, but what you're feeling is worse. I know, I understand. And when you feel this way...
So whether that's a good example of how you deliver self-compassion or not is, I think, beside the point. What I'm trying to demonstrate here is that some of the existing tools out there that provided for entertainment might be retrofitted for the use in clinical spaces. And that is one of the fascinating uses of virtual reality. Again, I'm not asking you to go out and do this. Depression is a significant and serious condition, and you would want to speak to your healthcare providers about this, but also maybe consider, if you are feeling low, that you might want to speak to friends or family, or even some of the online support groups as well. We can help. There is hope for people in these situations if you reach out for it. But isn't it interesting how virtual reality might be used to deliver yet another therapeutic modality? And it's this that I think we have to pursue further. We have to research it, we have to understand it more, and find a clinically effective and safe way of helping in this and other conditions as well. So, thank you for watching, thank you for listening. As ever, I'm really delighted to hear any feedback. You can reach me on the VR Doctor Twitter feed or on @KeithGrimes on Twitter. Or you can come to my website, www.drgrimes.co.uk, where this and all my other videos are stored. And if you'd like to join the discussion with other doctors and patients and developers and academics and clinicians, you can join our Facebook group, VR Doctors. But for now, I'm going to get back to playing with all these toys. And believe me, these are amazing toys, but they also have a possible use. So I think next time we'll maybe come to you from Vive, or maybe even HoloLens. So until next time, it's goodbye, and I hope you have a happy, healthy, and relaxing 2018.